is everyone's business, everyone's business.
The launch of the HIV Prevention Revolution Roadmap is what stakeholders in the health sector hope will facilitate elimination of new HIV infections in the country. By end of 2013, 1.6 million Kenyans were living with the virus,
which makes Kenya the fourth highest HIV epidemic country in the world.
Of the 1.6 million Kenyans, 13,000 are children under the age of 13. And while the National AIDS Control Council reports of a reduction in the number of new infections yearly, thousands of Kenyans are still at risk of infection. For instance, 32% of women between the ages of 15 and 49 with multiple partners seldom use condoms. And it gets worse. 89% of women between the age of 15 to 24 don't use protection with partners who don't know their HIV status. While in 2013, 30% of men reported having 2 or more sexual partners.
The entry point is to make sure that every eligible sexually active adult and a child that is exposed to HIV is tested.
The number of new infections in 2013 was at 88,620, a figure which reduced from 95,000 in 2007. With counties from Nyanza and Western Kenya recording the highest number of new infections. The infections are most prevalent in Homa Bay County with 12,279 new infections, which translates to 14.8% of the total number of Kenyans infected with the virus. Kisumu County recorded 10,349 new cases, followed by Siaya County with 9,869. Migori saw 6,786 new infections.
New infections annually are higher than the number of people we are enrolling on treatment. That is simply unsustainable. We cannot sustain that in terms of even a care and treatment program. When we think about the fact that for every individual treatment you're talking about almost $118 a year, then it means that every year we are looking at an additional 100,000 people that require those courses.
We have to put an additional 160,000 Kenyans on ARVs. But what I said also in that function is that life is priceless. And so if you have to spend 2 billion even to save the life of one person, that's exactly what we have to do.
65% of all new infections occur in 9 of the 47 counties, and those will be the target of the prevention strategy by prioritizing on new infections and effective tools to combat the spread of the virus. Esther Kahumbi, The Big Question.